Welcome back to the Nafeesa Dangor Show, where we're enticing you into different directions. And, we always ask ourselves, how important is it to keep into tabs with our kids and what they do? But I want to touch on an important subject this afternoon. A lot of the times, there's challenges that our kids face that we don't actually pick up immediately, and I think one of them is their stuff like their speech, their audio, the way they perceive things, and I think we only then tend to pick up the issues at a later stage. So today we want to educate you about those different aspects and what to look for. And our qualified speech therapist this afternoon, she's also an audiologist, is Faathimah Ismail. She graduated with a degree in BA in speech and hearing therapy from the University of Witwatersrand. She completed her community service at Groote Schuur Academic Hospital in Cape Town, where she worked as a speech therapist, treating adults and children in pediatrics. During her community service, she had the opportunity to work closely with highly qualified and experienced clinicians, which included a leading expert in stuttering therapy. Faathimah then worked at Chris Hani Baragwanath Academic Hospital in Soweto, where she had extensive exposure to and obtained considerable experience in pediatric speech therapy, pediatric audiology, and adult audiology. Faathimah is currently a part-time lecturer at the University of the Witwatersrand, who provides clinical education and supervision to speech therapy and audiology students. She is the founder of FI Speech Therapy and Audiology, which is based at the Stella Med Medical Suites in Amondi, Johannesburg. Assalamu alaikum wa rahmatullahi wa barakatuh.
Walaikum salam. How are you, Nafeesa?
Alhamdulillah. How are you doing this afternoon, Faathimah?
I'm good, alhamdulillah. Thank you for having me on your show.
Welcome to the Nafeesa Dangor Show. We're so excited to have you here this afternoon. It's so nice to see that you've taken off the time to actually educate us, because a lot of the times what happens is we notice, there's certain things in kids especially, besides adults, we don't pick things up until a later stage in their lives. And then we ask ourselves the question, what do we do? So it's so nice to see that you've joined us in the space this afternoon to educate us, of course, about speech therapy and audiology. And I think my very first question to you would be is just to talk a little bit about yourself and what enticed you to get into this field, because I think it's a very important one.
Sure. It's so many different factors.
Right.
As a child, I always knew that I wanted to be in the medical field. And having had, when you're in school and you're making decisions on your career, you do lots of research and you do lots of job shadowing. And that's what I did, and that's when I discovered the field of rehab. So physiotherapy, speech therapy, and occupational therapy. And I was really blown away by the three of these, just because I felt like you saw clients or patients through a journey. It wasn't just, like a once-off sort of exposure. And I loved that, seeing clients from the beginning and watching the growth as you go through this journey with these families. And I just find that very fulfilling. And I think that was a big contributing factor to me studying speech therapy and audiology.
And it's nice to see, because I think you have that trait in you where you look to help people out in many directions. And I think this is one way of reaching out to them, which is, of course, a passion as well. A lot of the times, as I was saying when we started, we look at young kids like, maybe toddlers, and we don't actually realize what it is that they're having. Sometimes they're stuttering and you think, oh, okay, maybe this is just a little growth spurt that's going down and we'll get over it. So from a parent point of view, what is it that you would suggest that they need to look out for in order to understand that there is an issue and that their child does need a speech therapist?
Okay, so there's a number of things that we have to consider, and I'm just going to go one step back. Is that first and foremost, we always look at hearing status. So is a child able to hear, or is a child struggling to hear? And I think sometimes what throws us off a little bit is a child sometimes responds to sound, but doesn't always respond to conversation and that sort of thing.
Mm.
And that's where we put a lot of focus on if even if you do go for a speech therapy assessment, we'll always recommend a hearing, at least a hearing screening before we do that assessment, because hearing is how your child is going to learn how to communicate. So the first step is that we always want to make sure that we know what the hearing status is of that child.
Mm.
The thing with hearing, though, is that it's a tricky one because
Mm.
hearing loss is invisible. A baby's born, and you would never know that a baby could have a hearing loss.
I would so agree with you there, and I'll explain to you why. I have a family member who's had a
Mm-hmm.
kid years ago, and we didn't know that our particular nephew had had a hearing issue until a particular age. He was probably maybe 2 or 3, and I stand to be corrected there, is when we realized that, he's not actually hearing us, he's reading our lips.
Mm-hmm. So children are excellent at compensating, especially in their first 3 years of life. The
Mm.
brain is growing exponentially at that point,
Mm.
and that's the level where it's best for us to know what's going on and to be able to intervene because of this brain growth that happens. And that's how we often miss these things, because
Mm.
children learn to compensate. Their instinct is to thrive and to survive. And so that's how we tend to miss it, because that's exactly what your nephew did. He started looking at people's lips, he started looking at body language, he started compensating by looking at nonverbal communication to aid
Mm.
his ability to function. And that's why I think it's so important for us to ensure that children are being screened. Even if they're just doing a hearing screening, it doesn't always give us a full status of hearing ability, but it does give us a starting idea to say, is there something wrong? Do we need to be concerned? Or is this child okay?
Mm.
Having said that, though, once we screen hearing, we always still watch a child behaviorally, because that's the
Right.
most important aspect that
Mm.
gives us an indication of the child's abilities to communicate, to hear, and to express themselves. Um,
I think that's
because
a very important point, because I think a lot of the times that's something we tend to overlook, because we think, oh, they're just playing, and okay, that's just the way it is. But what is it from a behavioral pattern that you would
Mhm.
look at to be able to pick up a scenario? Is it the communication issue? What sort of issue would a person or a parent be able to look for to be able to understand that there's something going down there? Because they're so young. Sometimes they may be a year or 2 years old, and the communication is not there, so they can't
Mhm.
relate what is actually happening to them.
Okay, so there's a couple of things that we look at, and communication is a big part of that. We want to make sure that children are meeting their language milestones, and
Mm.
now a lot of parents do have access to this information, because you get it in the packs that you come home with from the hospitals, and now with social media, all of this information has really sort of come to the surface, and you can
Right.
just Google what are the milestones my child is supposed to meet.
Right.
The problem that we often have is that milestones are the most basic level that we would want a child to be at a certain
Mm.
age. So,
Mm.
for example, at 1 years old, we want a child to start having some emergence of words. And when we say words, we don't mean adult-like speech, but
Right.
anything that is consistent and has consistent meaning for that child. So, if
So, like
every
some
time,
form of communication, whether it's a little word or something or the other
mm,
that you can look
mm,
for to know that they're being able to actually audio something out there, and of course that they're comprehending also on
mm,
what you're telling them.
exactly. And to make sure that if they aren't meeting these milestones, that we don't brush it off as, and I think very well-intended family members and friends always do, sort of give that advice, is like, just leave them. My friend's child spoke when he was 3 years old and it wasn't an issue. And then the parents are like, okay, I was concerned, but now I'm not that concerned anymore. And I think what we
And I
don't
think that's the
often
reason
see.
why I asked the question, because as you were saying, I relate to that. They
Yes,
say, oh,
yeah,
it's fine, don't worry about
it's
it.
just leave him.
We'll deal with it maybe in a year or so, they'll come right. I mean, maybe
Yeah.
he's just a little slower in catching on things. And I think
And
that's where we don't realize that there is a serious issue. And I don't know if you'd agree with me, but the way I see it, the sooner it's dealt with, actually, the better.
definitely. So, early childhood intervention is what we as therapists are really pushing towards, especially in the last
Mm,
couple of years, is because we've got so much research to support that if in the first 3 years of life we intervene, it actually has better long term life or life. So better life trajectory outcomes for that child, and it
mm,
actually is a cost saving measure because if you intervene in those first 3 years, children tend to need less intervention than if you intervene later on in life, just because of how we spoke about the brain having so much more ability to adapt and make new connections, where we finding that therapy and intervention at that level, whether being direct therapy or indirect therapy with family members, is making the most impact for children.
mm,
And just to move back a little bit is to say that for those kids where we're advising families to say, you know what, leave him, he'll talk, or leave her, she'll talk on her time, and we have a sort of a space, a little bit of leeway for that. But what people don't look at is that child that started at 3 years old. Research actually shows that when we go further in life to schooling and
mm,
literacy, we tend to
mm,
have a fall out there because of those early years and something happening there that didn't
mm,
have intervention. And these kids generally struggle with literacy and tend to have some schooling difficulties because there is something that wasn't addressed. And when we address these issues from the get go and you say, you know what, my child is 1.5 years old and he hasn't got a first word yet. What can I do? How do we intervene? And even if that
mm,
doesn't mean we need full on direct therapy currently, it's still important to seek out professional help. And even so, most therapists at that age would even implement home programs and parent training to get the outcomes that we would like for kids that are falling slightly behind.
mm. And I agree with you, like you're saying, when they're 1.5 and you've dealt with it already, the
Mhm,
transition into school is so much easier because they don't have
mhm,
that challenge that they're having to deal with now when we're picking it up at such a late stage, where they're now having to deal with two challenges as such.
mhm,
Firstly, getting into the environment of school alone is a challenge for a child because it's a brand new environment, and then also having to deal with this issue that they've had for such a long time.
mhm,
So I so agree with you. It's about being proactive to be able to see and watch a little bit more
mhm,
and get to know your child a little better, to be able to know, as you said, from the behavioral patterns,
mhm.
what is going on there and if there is an issue as such. But what
Definitely.
advice would you give to parents that are in situations that is, I think a lot of the times what happens is there's that fear factor. People, when they find out that there's something wrong with their child, there's always that question of where do I start?
Mhm. So it's very difficult, and that's where we find that balance needs to come in. Because when you as a parent start seeing, you know what, I see that my child's falling behind, immediately you start to mourn because this
Mm,
wasn't what you had expected. This isn't
mm,
following your expectations for your child. And when we and then, like, bits of denial go into it. And it's fine to feel those things, but we have to contact our professionals and see what can we do, even if it means that we're supporting parents emotionally while we start intervention with the children. So I
mm,
definitely think that the first thing that we'd like to do is to make sure that babies are being screened after birth. Most hospitals do them routinely, but now
mhm.
with COVID, there's sort of been gaps where children haven't been
Yeah.
screened because of all the regulations in the hospitals. And also, a lot of more people are opting for home births, and understandably so. So to make sure that you are making these choices, that you do follow up and make sure that you are getting a newborn hearing screening done.
Yeah, and I'm
And
sure they can come to people like yourself. I mean, I know there's that element of fear, and the
Mhm,
hospitals themselves, once the mom gives birth, wants to,
mhm,
just get them home because of that element of COVID that, they want to actually keep it away.
mhm,
But I think it's a good idea for now would be to interact with people like yourself to be able to see if there are any issues or not, because literally that's
mhm.
who can actually pick it up.
Definitely, and I mean, since COVID, actually, we've started doing home-based hearing screenings just to eliminate that factor of
Right.
parents and the fear of needing to go to a hospital to do the
Hmm.
tests. Um, and then once hearing screenings have been done, to be monitoring the child, like we said, in terms of
Hmm.
behavior. So is a child responding to sound? So when a door bangs, is there a change in behavior in your baby? By the age of 3 months, is a child showing some interest, or the baby showing some interest in speech? And then
Hmm.
for older kids, are they following instructions? Are they always saying what or huh, or never really understanding the full message? And often as moms, we're like, oh, this child's so naughty, she doesn't listen. And just
Hmm.
sometimes take a step back, and is it just that she's not listening to you, or is it that she doesn't hear part of the message?
Hmm.
And then kids that are struggling with literacy and kids that are struggling in school, it's so important that we make sure that we at least have their hearing screened, so that we know what's going on in that perspective. And
From
then once we know about
a,
the hearing, that's where we can look at the speech and language and the communication at large, to see what's going on, and why a child's falling behind, if the hearing is actually okay.
right. So tell me,
Mhm,
a lot of the moms that are at home, how do you
mhm,
encourage them to communicate with their children? I mean, sometimes the moms are so busy they don't even pick it up. So, would you say that maybe they need to do some interaction playing, or sort of, mind games, or what sort of games can they do to play with their children, to be able to understand that there is
mhm,
something deeper going on, and it's not like, as you were saying earlier, that their kids are just not listening, or they're
mhm,
not being, uh, should we say, behavioral, or their manners are not there. It's just that they're not
mhm.
understanding, and I think the comprehension is not there, because if you can't hear, of course it's a problem. You can't talk, it's a problem.
Yeah. So, look, there's so many things that we can do at home with our little ones. And firstly, as a mom, I can tell you, it's crazy, especially if you work, you've got the household, there's so much to do. And that's why I like to always focus on routine-based intervention, where
Right.
where you're intervening in terms of speech and language and communication, in a child's daily routine. So we're doing language stimulation in bath time. We're doing language stimulation when we're having a meal. We're doing language stimulation throughout the activities that you have to be done in the day, because it is difficult to sometimes sit for a certain amount of hours a day just to do intervention or play
Mm,
with a child per se.
mm,
So I'm not playing with children is great, but a big one is talk to your kids. It's so important. I think sometimes we don't, and for some it's sort of learned behavior, is that in certain families people don't talk to children. I mean, he's a baby, he can't talk
mm.
to me, but talk to your children. It's very important for language stimulation. Lots of repetition. So kids learn through repetition, kids learn through routine, hearing it over and over again. That's how they pick up, and that's how they develop, and that's how they learn.
Right.
Um, yeah, so there's lots that we can do at home. Introducing book reading into your routine, and not as in a boring let's read a book. Is to get in there and get creative when you're opening a book with the child. Ask the child to turn the page, pointing at things, naming things. Those are all very interactive
And
ways
there's
of.
so many nice interactive books that you get nowadays. And I mean, I found them in the toy stores. They're so amazing. They have these little sound effects with them and stuff like that. So I think that's a great idea, because from engaging with that, you'd be able to also understand what is happening with your child, if they actually
Mhm.
caught up on that sound, or did they understand what happened with a particular object, maybe playing with those shapes. So I think there's a lot of things parents can do to be able to integrate. And I love your idea of incorporating it into your daily routine, so it doesn't become like something extra that you need to make time for, and you tell yourself to, I don't have enough time for it.
Yeah.
So I kind of love that idea, because even if you're just bathing your child and you're playing with the toy in the bathtub as such, it's already one idea of getting to understand whether your child is having a serious issue or not.
Definitely, definitely, and lots of language modeling. And
Hmm.
that time where if you're engaging with your child, you're going down to their level, you're making eye contact, and you are communicating with your child. So, adding gestures while you're speaking, those are all holistic. That's holistic communication, and that's how children pick up and
Hmm.
actually start communicating.
That is
Um,
so true.
and yeah, and just to be aware of these things, and like you said, we're not saying you have to take out specific time where you feel like you don't have that time, because it's crazy. But to have the time that you do have with your child, to maximize on it and to use it to enhance your child's development. And I think that's very important. A lot of the time we think if we're buying expensive toys, that's going to be great. But
Hmm.
actually, to buy open ended toys are the best things for children. And you often see a child, you buy this really fancy toy and then they'll play with the box
Yes.
because it's
That's so
so
true.
much more that a child needs to think, use their cognitive ability. They get to imagine, they get to pretend, they get to manipulate this object in different
Mm.
ways. Whereas if
And
I
it's
just have a
also
toy to press a button,
that's boring.
it does everything for me, and
And
that's not actually great for development.
I agree with you. I mean, it's so nice. Like, because even if you're in the kitchen, and my nieces do that when their
Mhm.
mom is baking, they get avidly involved in doing it, and it's so nice because then it's getting their motor developments going. It's getting
Mhm.
them going in many directions. So, as you
Yeah.
were saying, incorporating it into your daily schedule, it's actually not difficult at all. But I think you've given us some really important pointers this afternoon. It was a very valuable conversation. What message would you like to give our viewers this afternoon?
The message that I'd like to give is to look at your child as an individual. And as a mom and as a parent,
Mm.
trust your gut. If you think that something is not okay, leave everyone alone. Leave all the messages from previous generations saying, just wait it out. Follow your gut. Even if you contacting a therapist, a speech therapist, if you're speaking to your pediatrician, make sure that you are getting the intervention so that you are working beforehand, or you're working smartly where you can actually prevent something from getting worse before you
Mm.
by actually dealing with it immediately. So I think first, just trust your gut, enjoy your little ones, and see them as an individual.
Yeah, you're right. You couldn't have said that better. I mean, because they grow up so quickly. Mine's 24 and done with.
Oh,
I was like, I can't do those things, so I do them with my nieces and nephews. But I so agree with you. It's having, and it's also spending that quality time with them. So you've definitely shed some very important light on the matter. And I so totally agree with all the pointers that you've brought up. And I hope this has helped all our parents out there to be able to see a better perspective of how they can help their kids as far as this aspect is concerned. And also knowing that there's a support structure like yourselves out there
Absolutely.
that they can go to that could help their kids from a younger age. And the sooner the better, as I said earlier, so that when they do go into the school environment, they're kind of prepared for the situation that they're going to have to face. So, Jazakallah so much for joining us this afternoon. We really appreciate the time that you took off to entice us into a better space and a better place as far as parenting is concerned. Thank you so
Thank you
much.
so much
Assalamu
for having
alaikum.
me. Walaikum salam.
The pleasure was ours, my dear. Thank you so much. That was Sister Fatima Ismail, definitely teaching us how to look at our kids in a different light. right? To see that from their behavioral patterns, how we can really help them as far as audio and speech is concerned, and to see and determine from there. She literally educated us to determine from a very young age if there's a problem, but there are people like themselves out there to be able to give us the necessary from that very young age, so that when they do go into the school environment, they're prepared for it. Stay with us. We're going to be back with Cape Town Tours.